Hey guys, happy Monday. I have not done a Monday video, I feel like, in ages. So let's get cracking. Today I'm going to talk about something that's a little bit controversial, at least in my field, and that is tongue ties and lip ties and whether or not we clip them and cut them and everything else. So it's a big area of conversation. I think a lot of pediatricians are seeing a massive increase in recommendations or referrals to people to get these tongues clipped and or lip ties to get them cut as well. And we're seeing a lot of referrals come from lactation and just parents asking in general because they're seeing it in mom groups like, oh, my kid has a tongue tie or lip tie, I need to get it clipped because I don't want them to have feeding problems or speech problems. So the biggest thing, number one, you're going to hear a lot of different opinions on this. And whether they're wanted opinions or unwanted opinions, you're going to get them because that's just the world we live in and it's thrown in your face, just like I'm giving you an opinion on it today. So, my personal opinion on this, I agree with what you're kind of hearing me say already, is that these are being vastly overdone right now. I think too many people are getting unnecessarily clipped and cut, and I hate to see it, but all I can do is try and educate my patients on it, and hopefully you guys out there so you can form your own opinion or at least work to get more information so you don't maybe do an unnecessary procedure on your child. So, rule number one, I always tell parents is you can't go just off of how it looks. So, there are a lot of, I see a lot of babies and I've seen a lot of kids in my career, and people will have a tongue tie, which is just kind of, let me show you a picture here, like under there, the skin from the tongue, from under your tongue, kind of connecting. I gotta look at my camera here. Right there. And sometimes that skin is too far forward. And so what happens is the babies can't stick their tongue out. They might only be able to stick it out like this. And they can't, or not even past like their gum line on the bottom. So we have to look at the function. We're like, okay, what can this tongue do? Some babies can have a tongue tie where it's really tight here, but they can actually push their tongue out past their gum line, past their lip line, despite it being so attached there. So we as physicians are going to look at the function, like, okay, can the tongue do what it needs to do to help feed and speak and have, this good function? You can't just look at it. You cannot just make a decision by looking at it and that's it. At least you shouldn't. Now, I will say people are making decisions based off of that, but that's not a good way to do this, okay? So, I have a lot of theories as to why this is getting done, but I'm not going to go into that on here. I just want you guys to be aware that there is an increase in this procedure, and I don't think it always needs to be done. So this is a conversation you do need to have with your pediatrician, especially if lactation is meeting with you and saying, yes, first thing we need to do is clip that tongue. Just make sure you're having multiple conversations before that actually happens. There are a lot of times when these babies do just need really good help with lactation and working on different techniques and stuff. And a lot of times they ultimately don't need to have their lips cut or their tongues cut or any of the ties cut and clipped. Now, that being said, I have encountered many babies in my career where I do recommend that they get clipped. I have watched a feeding and I've watched their tongue motion. I've assessed their mouth and things aren't moving how they should be moving effectively. So yes, I do refer for clipping when I think it's necessary. It's a very simple procedure. A lot of times it can be done in the office too. I've done them in the past. It literally takes like 10 seconds. It's not something that needs a really fancy procedure to take place, like lasers and things like that. I know that's out there, but oftentimes I will now just refer to a really good ENT doctor, even sometimes to get a second opinion from them because they see a lot of it as well. So if I'm questioning it, parents are questioning it, we're going to collaborate together to make sure we make the best plan for the family and the child. So just make sure you are not just going off and getting this done and having a good conversation with your doctor as well, okay? I hope this is helpful and everybody has an awesome week. Thanks.